For me personally, it's been a passion for many reasons. I'll cite that later as well, but also because my mom, she likes to give me a hard time because she wanted me to be in the healthcare space. She wanted me to be a doctor. So because I failed her, then at least when I do talks like this and we work with clients in the healthcare space, at least I can live vicariously through you and tell my mom, so she can get a little happy. So even if I can't be you, I can be near you. Happiness of an organization and happiness of self is when what you think, your strategy, say, your brand, and do, your culture, are in harmony. Focus on the me first because, again, the goal is to make sure you as an individual feel whole at work. You feel authentic. You feel like you're living your purpose and values. At the same time, all the me's in your organization are accountable for what they say they're going to do. Then we extend that to the we, which is your dynamics between your team, different departments, different functions, and then ultimately it's your community. Obviously, your patients, but everyone in your ecosystem that you touch as an everyday person, as a practitioner, or whoever you are in your organization. Really interesting because they had a culture committee that they just formed before we got there. And they said, can you help us figure it out? Because obviously we know our purpose. Let's keep kids healthy. Why is it that our employees are so unhappy? So we said, all right, just for one moment, let's set aside the doctors and nurses. Let's think about who are the most important people in your organization. Let's think about your frontliners. The first point of contact that your customers or your patients actually see and experience are the people at the front desk. What if you were to give them a sense of control and autonomy so that they feel that they own this experience? What if you were to do that and see how you could change the dynamic of who they are as a person? And a gentleman came up to me after and he was really excited and he's like, I totally get it. I get it now, I understand. I love going to my doctor's office. And I was like, that's amazing. Who loves going to the doctor's office? He's like, tell me more. And he's like, well, last time I went to the receptionist, the same one that I see every time, and she whips out her business card, and on it was her title that said, Director of First Impressions. Yeah, and this is just such a simple concept. No money, it's just really giving her that autonomy and empowerment of, I'm gonna own this job because this is who I am, and this is aligned with my higher purpose. He comes to one of my talks, sees this, and realizes, you know what? This is what we need to do. We got to focus on culture. Because he noticed that he would walk into the hospitals, walk into the location, and there was just a complete disconnect. And especially in the healthcare space, I'm trying not to preach to the choir here, because there's so much origin of your original passion, your original purpose, of why we actually started working in this field in the first place. But because of bureaucracy and because of red tape in government, it makes it so hard to have this sense of how can we actually be happy when there's changes that we need to adapt to on a day-to-day basis.